If you'd like to ask a question, please raise your hand using the hand icon or send the host a chat with your name and outlet to be placed in queue. Should you require assistance during the call, please message the event host directly for assistance. I'd like to introduce today's first speaker, Director of Public Works, Mr. Mark Pastrella. Mr. Pastrella, the floor is yours.
Appreciate everyone for being here today. As the Director of the Los Angeles County Department of Public Works, I act as the Chief Engineer for the Los Angeles County Flood Control District. And today's incident that we're giving you an update on, the Los Angeles County Flood Control District is acting as the incident lead. We are working in a portion of our system that is known as the Dominguez Channel, and this incident is named the Dominguez Channel Odor Incident. The Los Angeles County Flood Control District serves all of Los Angeles County. That's some 4,000 miles. We operate all the major dams in Los Angeles County, 14 major dams. We also run 500 miles of channel. Some of those channels that you're aware of are things like the LA River Channel, the San Gabriel River Channel, Iona Creek, and here, yes, Dominguez Channel is a piece of the infrastructure that the citizens of Los Angeles County pay the district to maintain and operate on a daily basis. Again, the section of the channel that we're focusing on has been, and what the incident is about odor emanating from within our channel. And I'll talk a little bit in a minute about why that odor is occurring and what we're doing to restore the channel to its natural system so that it will stop causing the nuisance it's currently causing. Before I go on further, though, I want to thank you for being here again, and I appreciate you following this story and keeping residents informed. And with that, I want to make sure the media gets out our call number, 211, for anyone who needs help related to this incident. Again, that number is 211. And if you mention the Dominguez Channel odor incident, we'll more rapidly be able to give you resources. I'd also like to thank LA County and Carson City officials that have been working collaboratively to investigate and address the pungent odor affecting communities in the area of Dominguez Channel. This includes City of Carson, LA County Department of Public Health, LA County Fire and Health Hazmat, and the South Coast Air Quality Management District, along with our federal and state partners who are counseling and giving us background and aid as we move forward to remediate the situation. The county's top priority here is the safety and well-being of the public, and we are bringing all available resources to bear to alleviate this issue. I thank you for your patience, and it's important for you to know that your health and sense of well-being are just so very important to me and to those of us that serve you. I was at the channel yesterday, and I can confirm firsthand that the odor is still very much a nuisance. The county is working around the clock to alleviate the source of the smell and provide you and your neighbors relief from its effects. Now, AQMD's overnight reports are showing drastic reductions in gas readings, the lowest level since the incident began. We're making progress and moving the needle on all fronts, and our goal remains to be transparent, inclusive, and equitable during this recovery. If you have been, believe you've been affected by the odors coming from Dominguez Channel or have questions about this incident, call the county's 211 helpline for information. Now to recap the incident. On October 7th, the Department of Public Works was notified of a potential incident within the Dominguez Channel. The channel is part of the county's broad system of flood protection and water conservation. It's 15 miles long and it runs north to south through the communities of Hawthorne, Gardena, Carson, and Wilmington to its discharge point in Los Angeles Harbor. As a result of the complaints we received, we brought in personnel to investigate and, through science, discovered anaerobic conditions within the channel. A lack of oxygen within the channel during the decomposition of vegetation and other organic matter resulted in a process known, again, as anaerobic digestion. The result of this natural process is hydrogen sulfide gas. Now, hydrogen sulfide is a colorless gas known for its foul or rotten egg or sulfury smell, even at low concentrations. It's used or produced in several industries, including oil and gas refinery. However, in this case, it's a result of a natural phenomenon occurring within our system. My staff continued to spray Epoleon, an all-natural biodegradable and water-based spray to control and mitigate hydrogen sulfide gas. The compound is designed to reduce hydrogen sulfide gas and convert it to a byproduct of salt that will be removed in a subsequent process. Spraying will occur from overpass bridges into the channel as the tide comes in to maximize the exposure and impact the spray. Our goal, while the tide comes in, is to move the neutralizer further upstream to the rest of the channel and facilitate wider spread and neutralization of the odor. In fact, we're looking at some really unique ways to spread this, including the potential use of drones along the channel. We're installing a series of nanobubblers on top of this that will sit on the bottom of the channel under the water and force air into the channel to increase oxygen levels. 2 operational and 3 more will be operational by next week. This process will convert the channel environment from anaerobic decomposition to aerobic decomposition and eliminate the production of hydrogen sulfide gas. To put it in simple terms, the faster we reduce the hydrogen sulfide gas concentrations, the sooner the public will be relieved from this nuisance. And in fact, we're making headway in reducing the amount of hydrogen sulfide gas escaping the channel. Our readings show that we're moving it down, but I know that it continues to occur at a level that is a nuisance to the community, and I'm working with our health department to define and to understand when it will no longer be a nuisance to the community. With that said, I can't predict when the event will be over for individuals because each individual has a different sensitivity to hydrogen sulfide gas. And so I'm again relying and working with our health department to make sure that we get it right. Again, we continue to work with our health department along with the State Department of Public Health on deploying lighting standards to control bacteria growth as well. This is an interesting exercise that we're working as well. We're putting up some high intensity lighting because we believe the bacteria that we're trying to break down is also photosensitive. So 3 things we're doing currently at the moment. We're actually spraying to deodorize and to break down the hydrogen sulfide as it escapes. We're aerating with the air with a high efficiency aerator in the system, and we're working with an interesting idea, lighting the channel during night because we believe that it's the bacteria is photosensitive. Lastly, we are considering dredging the channel to remove all decomposed organic material from the bottom as a part of a channel restoration effort to restore the estuary to natural functions. Now, that big project could take many months to implement, but that's not where we're working right now. We're working right now to relieve everyone of the nuisance by reducing the hydrogen sulfide. Again, your safety and well-being of the communities is the reason we serve, and it is our top priority. Now, we're creating a plan to bring aid to communities. We were mindful of many factors affecting our community, such as limited mobility, economic hardship, and other significant barriers. We've collaborated with affected communities, engaged with them in a culturally competent and community-aware public outreach campaign and reimbursement program. That program includes purchasing air filters, portable air filtration devices, hotel accommodations, and more to alleviate the financial burden on affected residents. We recognize that not all our residents can afford to wait for the reimbursement. Therefore, we have purchased portable air purifiers in those situations, for these situations, and secured a block of hotel rooms at multiple hotels across the county to provide more immediate assistance. The air purifier distribution site is at Victoria Regional Community Park, located at 419 Martin Luther King Jr. Street, Carson. Again, 419 Martin Luther King Jr. Street in Carson. Public Works and Department of Public Health are at the Carson Community Center as well, at 801 East Carson Street, providing information and assistance with reimbursement forms. We also partner with the City of Carson, County Fire, and Public Health to visit homebound residents in need. If you or someone you know is homebound and in need, please call the center resources of the 211 helpline. Again, if you know someone who's in need or homebound, please call 211 or visit our incident website at lacounty.gov. Emergency Dominguez Channel, and that'll be on the board before we leave today. We continue to develop and improve processes for distributing aid and assistance to the community. And again, I appreciate your following the story and keeping residents informed. We provided digital content, both still images and B-roll, at a link you will find on the slide provided on the screen. Or you can send a request to pio@pw.lacounty.gov. Again, for the media, if you'd like B-roll or a link to images, please go to pw.lacounty.gov or to the sites that are listed on the screen. Now I would like to introduce Dr. Jason Lowe, Assistant Director of Air Monitoring at South Coast Air Quality Management District. Thank you.
Thank you, Director Pastrella. So as mentioned, I'm the lead for the Air Monitoring and Analysis Division at South Coast AQMD, the local air quality agency for the region. And South Coast AQMD continues to partner with the LA County Public Health, LA County Department of Public Works, LA County Fire and Health and Hazmat, and other local agencies in this response. And we appreciate their collaboration to address these air quality concerns as a top priority for all of our agencies. We continue to respond to odor complaints and have responded to more than 3,000 since the beginning of our investigation. And to call in odor complaints, you can call 1-800-CUT-SMOG. 75% of our total calls have come from the residents of Carson. However, we are still seeing odors affecting those who live in Long Beach, Gardena, Wilmington, and other neighboring cities. We are fully deployed and continue to use a variety of air monitoring technologies to collect pertinent data from locations around the Dominguez Channel. This includes mobile monitoring on a mobile platform, handheld devices, and a robust fixed air monitoring network spread throughout the communities. Our teams are assisting the Department of Public Works with air monitoring near the odor neutralizer spray site. We also continue to be actively engaged at schools and focus our air monitoring efforts in the surrounding residential communities. The highest levels of hydrogen sulfide that our inspectors have observed continue to be concentrated at or in the close proximity to the Dominguez Channel near Avalon Boulevard and the 405 freeway. To supplement our ongoing data collection, a new fixed monitor has been placed at a location closest to the residential community at 213th Street and the Channel to provide 24-hour air monitoring to evaluate patterns and impacts to the nearest communities. We continue to see elevated levels of hydrogen sulfide at that 213th Street monitor, which is very close to those communities. And it's mainly at the middle of the night and in the early hours. But as Director Petrilla has alluded to, the levels have declined to around 80 to 90% since Sunday. When we see really high levels, we immediately inform our partner agencies and deploy inspectors closer to communities. So far, we have found that we're not seeing the same high levels closer to the homes, even 200 meters away from the channel, and those levels drop lower as we step further into the community. This does not mean that the odors are not present. As Dr. Petrilla has mentioned, we understand the potency of hydrogen sulfide and recognize these odors still present a strong nuisance and can impact the community even at very low levels. We continue to keep an eye out on the data, weather, wind direction, and any other factors that can impact the plume to affected residents and communities. We continue to share our data with our partners at the LA County Department of Public Health, and we are posting our data at our website, www.aqmd.gov. And again, to mention the number that the public can continue to report odors to South Coast AQMD is 1-800-CUT-SMOG, and the number is 1-800-288-7664, or by using the online complaint system found on our website. And now I would like to turn it over to Dr. Muntu Davis, Los Angeles County Health Officer with the Department of Public Health. Thank you.
Good morning, everyone. And I'd like to say thank you, Dr. Lowe and Director Pastrella, for all your work. And thanks to everyone for joining us today. For some time now, the Department of Public Health has been in the Carson community and at the Carson Community Center. We've had team members canvassing Carson neighborhoods, businesses, and schools to share our latest health recommendations, which are available online at lacounty.gov/emergency, again, lacounty.gov/emergency, and to answer questions and to provide technical assistance on how to reduce odors indoors. So far, we've visited more than 7,000 homes, nearly 200 businesses, and all of the schools in the local community. What we hear time and time again is that people are frustrated and they're worried, and that's understandable. I want to assure everyone that Los Angeles County Public Works is diligently working to get rid of the hydrogen sulfide odors and address the issue causing them, while AQMD monitors the air quality and reports levels, and Public Health, in consultation with AQMD, Los Angeles County Fire Health Hazmat, and state and federal advisors, continue to reassess both the situations and the actuation of the actions recommended for the public to mitigate any potential health impacts. I know there are a lot of questions, particularly about hydrogen sulfide, and if there are many or any serious health concerns after how long people have been smelling it. In most cases, contact with hydrogen sulfide, your symptoms are usually related to how strong the odors are and the way your body responds to those odors. We refer to this as a physiological response. Contact with hydrogen sulfide may cause symptoms including headaches, sometimes accompanied by dizziness, irritation of the eyes, nose, throat, and lungs, which may be accompanied by tearing up or coughing, nausea and abdominal discomfort, which in some people may also lead to vomiting. And some symptoms may appear earlier and may be worse in people with existing heart and lung conditions such as asthma, where the smell of hydrogen sulfide may cause an asthma attack. Since the beginning of the incident, hydrogen sulfide readings in the air have been low enough that these symptoms are expected to be transient, short-term, and reversible. It is important to note that the symptoms are due to the smell of the odors and are not expected to be due to hydrogen sulfide accumulating in your body. In other words, symptoms tend to go away when you leave the area or when the odors decrease or are no longer present, which is what we all hope will happen in the near future. In talking with people in the Carson community, some have expressed concerns about how long the smell has been in the area and want to know if they should be concerned about exposure to hydrogen sulfide over several days, weeks, or months, even though the levels are low. The answer to that is, based on what we're currently seeing, we generally do not expect people to develop long-term health issues after this odor event goes away. Hydrogen sulfide is a gas that does not stay in your body for very long. In other words, your body clears it rather quickly, which means that low-level exposures do not tend to pile up inside your body, even after you're exposed for several days or even weeks. What this means is the health effects from hydrogen sulfide are related primarily to the level found in the air and much less on the time that you're exposed. Most medical studies that have examined the possibility of long-term permanent disability after hydrogen sulfide exposure have shown that this tends to occur after an individual experiences extremely high-level short-term exposures in the range of more than 40,000 parts per billion or 40 parts per million over 10 minutes. The Environmental Protection Agency, or EPA, has determined that you would need to be exposed to about 27,000 parts per billion for an hour straight, or 17,000 parts per billion for 8 hours straight, to be at risk for permanent or irreversible health effects. These levels are much closer to potentially life-threatening levels, as opposed to the levels that AQMD has been reporting during this event. Although some outdoor 1 hour average air readings have occasionally reached as high as 7,000 parts per billion, these levels have been transient and fleeting and occur mostly at night. During the day, outdoor readings have consistently come down to levels below 1,000 parts per billion, which most people can easily smell. The takeaway here is that these levels have not come close to the levels that are expected to cause permanent, irreversible, or long-term health effects. Yet these levels are considered a public nuisance that must be addressed, as has been directed by our department. As public health has been advising, people with pre-existing medical conditions, especially heart or lung conditions, should work closely with their healthcare providers to determine the impact of this exposure on their medical conditions and ensure that they have adequate supply of their medications throughout the event, especially if they're going to remain in the area. Two specific areas that we expect more questions about include hydrogen sulfide exposure and its impact on pregnancy, as well as its lifetime cancer risk. It's not fully established whether hydrogen sulfide causes birth defects in people. However, the results from animal studies in animals, where we get a lot of our information about chemicals and birth defects, suggest that exposure to low concentrations of hydrogen sulfide during pregnancy does not cause birth defects. Published studies to date have not shown hydrogen sulfide to cause cancer in humans. That said, public health does have some very specific recommendations for residents. There are several things that you must do during the current odor event. First, if your symptoms feel life-threatening at any time, seek immediate medical care. And if symptoms are persistent, worrisome, or worsening, seek medical attention and relocate to another area until odors go away. As mentioned before, you can call 211 for relocation assistance. Residents should also avoid lengthy outdoor activities between the hours of 9 p.m. And 8 a.m. and whenever odors are strong to reduce their exposure. As mentioned previously, residents should keep doors and windows closed as much as possible to prevent outdoor odors from entering their residence or business. And residents and businesses should also air out their home or business when odors are not present. If you have a central heating, ventilation, and air conditioning or HVAC system, contact an air conditioning specialist if needed to determine if the air filters in your system may be replaced by a HEPA or MERV-rated filters with activated charcoal or carbon to improve the air quality inside your residence or your business. If you notice odors are stronger or symptoms are worse in the late evening or early morning hours, again, between the hours of 9 p.m. and 8 a.m., try running your central HVAC system throughout the night if you haven't done so already. And if this doesn't work, then temporarily relocating may be best. And for residents who don't have a central HVAC system, you should use a certified public portable HEPA filter with activated charcoal to improve air quality in your home. And again, if you notice odors are stronger or symptoms are worse in the late evening or early morning, again, between the hours of 9 p.m. and 8 a.m., try running the portable indoor air filter throughout the night if you haven't done so already. And again, if this doesn't help, temporary relocating may be best. And finally, please keep pets indoors. They can have similar symptoms as people. And if you notice any difficulty breathing, vomiting, or extreme tiredness or nausea in terms of your pets, please contact your veterinarian. For businesses that may be impacted by the foul odors, if you notice strong odors inside your building during the last week or over this time when opening in the morning, we recommend that businesses run their air conditioning units 1 to 2 hours if possible before on-site operations begin. Doing so will increase airflow inside your business and help reduce any odors present that may have built up overnight. For more information on protective measures to prevent odors from entering the home, residents can contact the Public Health Community Line at 626-430-9821. Again, that's 626-430-9821, and leave a message with your contact information and your call will be returned. The message line is checked every hour between the hours of 7 a.m. and 10 p.m. every day while the odors are present. Thank you, and I believe now we'll start answering some questions.
Ladies and gentlemen, if you'd like to ask a question, please raise your hand using the hand icon or send the host a chat with your name and outlet to be placed in queue. As a courtesy to other reporters and to allow time for ample questions, we ask that you please limit yourself to 1 to 2 questions per reporter. One moment, please, for our first question. Our first question comes from the line of Margaret Carrero with KNX. Margaret, your line is unmuted. Please go ahead.
Thank you. Are you able to hear me?
Yes.
Okay, very good. This is for Mr. Pastrella. Thank you for taking questions today. 2 questions I have. Where do we stand with the number of claims for reimbursement and how many have been approved? Also, where are you in the investigation of the possibility that there may have been some chemicals that were released into this channel, and what do we know about that at this point?
Okay, thank you, Margaret, and good to hear your voice. So some stats on the reimbursements. We placed 26 households at 3 hotels. Those hotels stays are being extended through the period, so I want people to know that they can continue to seek relocation and not to be worried about some end date we put in there, because we do have an end date on our reimbursement form. We have received 1,749 calls have been received at our 211 LA call center. 1,000 calls were received at our public works, or at our own public works call center. So that's 2,800 calls. We've had 1,157 visits to our community center site, the Public Works Community Education Vehicle at the Carson Community Center. With respect to reimbursements, we've received 2,939 reimbursement requests, and of which nearly 900 requests have been approved. Let me look at the number. 857 requests have been approved. A little bit of information on that. We are at the point now where we are able to take a call and within 24 hours give a response back to the applicant who is seeking reimbursement, basically telling them that what they're attempting to buy is something that we will pay for. We also, in that first phone call, will make a human touch with those that are making application to make sure they are getting the resources they need, whatever they might be. As to contributing factors is what you're asking about to this situation. We know that we have found that there are chemicals within the system, our system, that raise curiosity for us about how they got into the system, into the specific area. We also know that those non-flood control, non-rain constituents, non-water constituents are contributing to the anaerobic digestion that's occurring, and therefore increasing or growing the bacteria that produces hydrogen sulfide. And so there is a direct nexus to this, to human health and to the nuisance that people are experiencing. I am conducting an investigation, and because this is an investigation that could both be criminal and civil, I'm at this time unable to speak to that about the details of that investigation.
Thank you. Our next question comes from the line of Jackie Fortier with KPCC. Jackie, your line is unmuted. Please go ahead.
Hi, thank you for taking questions. Mr. Pastrella, the leach pond from a Class 2 landfill in Carson runs directly into the channel. When you checked the monitoring wells at that landfill, what did you find?
Yeah, I don't have the answer for you from a water column perspective. What I know is that we've checked each source, input source into the channel, including our laterals to locations like that you're describing, and we've confirmed 2 locations that are curious, but they do not involve a landfill. And that is what I'm speaking to, is that we found residual materials in 2 laterals that have led to the investigation that I just spoke about. But specifically to the landfill and their pond operations, I don't have any evidence in front of me that they have been a contributing factor to the conditions that we're experiencing.
Our next question comes from the line of Hunter Lee with Daily Breeze. Hunter, your line is unmuted. Please go ahead. Hunter, your line is unmuted. Please go ahead. Moving on to our next question from Alejandra Reyes Velarde. Alejandra, please go ahead.
Hi, thank you. Can you hear me okay?
Yes.
I want to ask about a lawsuit filed yesterday by Carson residents alleging that a fire on September 30th and the debris and hand sanitizer that was left over after that flowed into the channel and then caused this process to create the hydrogen sulfide. I'm wondering if you're aware of this lawsuit, if you can comment, and whether that's like a plausible thing to happen, that debris and hand sanitizer may cause this process.
I'm not aware of the lawsuit, and I'm not privileged to speak to it in any form, as I said earlier. Nor can I speculate about the materials that you listed at this time.
Thank you, and we have one last question in queue, and that is Phoenix So with KPCC. Phoenix, your line is unmuted. Please go ahead.
Hi, can you hear me?
Yes, I can.
Yes.
Okay, sorry. Yeah, just a couple questions about the prospect of dredging the channel. I was wondering why that presumably is not being prioritized at this time, because presumably it would be the most direct way to get rid of the smell. And then also, is it also a matter of the federal government having to authorize it? And where are you in that process?
Thank you. In fact, that operation is considered a priority. The length of time to conduct that operation is what we're already in the process, if you will, of doing that dredging. And it requires, as you mentioned, it requires significant planning, significant movement of material. It could be actually cause more of an acute problem to start with, because by leaving the materials in place and actually stopping the anaerobic digestion here in place, we see that as the fastest way to knock down the hydrogen sulfide. And with that knockdown, then we stop the nuisance smells that are occurring. The dredging operation, yes, it is regulated, it will be regulated. It is continually regulated by the federal government as well as state, and then our own local codes come into play, but those have not been in any way or been seen as a somehow a blocking factor in our ability to make the decision to start dredging when we do start that dredging. We're working very closely with the federal government, both EPA, the Army Corps of Engineers, the state government, the Regional Water Quality Control Board, the State Water Quality Control Board, and Department of Water Resources on that operation. But that is not in an incident, in a response, something you would that we think was the right thing to do at this moment, and that you're assuming it would actually be the quickest way, and actually we saw it as probably the longest way to resolve the acute issue.
Thank you. And panelists, we have received a few additional questions. Hunter Lee, your line is unmuted. Please go ahead. Hunter, last call. Your line is unmuted. Please go ahead.
Can you guys hear me?
Yes.
Oh, perfect. My question's in regard to Apollyon. Will this deodorizing agent flow from the channel into the harbor, and can this have any negative effects on the sea life or residents?
Thank you. Was one of our first concerns, and use a non-toxic substance to animals or humans or even plant life. And in fact, Apollyon is made of biodegradable substances that will break down and do not discontinue to exist once they over a period of time. So the Apollyon, if you read about it, really it affects the gases leaving the water. Once it touches the water, it can float on top of over a very, very short period of time. It breaks down biodegradably.
And we have a follow-up question from Margaret Guerrero. Margaret, your line is unmuted. Please go ahead.
Thank you so much. Mr. Petrella, one more time, just want to kind of circle back to, I know you can't talk about the investigation or details of that at this point, but you know, when someone hears the idea of potential chemicals being released into this channel, are there any concerns about effects of what that might be? Do we know if that could cause any more problems than we're already having for people in the community there?
Thank you, Margaret. And you know, you followed us for a long time. We're concerned anytime anyone puts anything purposely or accidentally discharges anything other than stormwater, rainwater into our system. That's the only thing that belongs in our system. We routinely recover incredibly improperly disposed of materials in our channels in LA County, the waterways in LA County. Dominguez Channel is no different. It is there. We have found materials within the water that are indicative that there was some discharge at some point before the incident occurred, which we do think is contributing to the growth of anaerobic a bacteria that is using anaerobic system to digest and to break down the vegetation in the area. Interesting enough, it hasn't been asked, but I want to tell you that what we're doing is we're killing that bacteria by introducing oxygen, pure oxygen into the system. And you can actually see foaming, which is dead organisms reaching the surface. This is why we realize that the microbubble system that we're using is going to be the most effective way, aerating essentially. The water is going to be the most effective way to acutely knock down the hydrogen sulfide at this time. And we are seeing reductions in the hydrogen sulfide, which for the public that you're going to report to should know this is a good thing, because this is what will ultimately stop the smell from happening. And I want to again mention that the public will all at different times be relieved, because each human is sort of different in terms of how you interpret and the way you smell and how sensitive you are to this smell. So as Dr. Davis has been mentioning, we're really watching closely, and we're making sure that this is understood and that we're not having any long-term chronic or to cease the acute. And we want to stop the acute healthcare issues by reducing the hydrogen sulfide. And again, for the reporters, We have seen the hydrogen sulfide from the beginning of our application of Epaleon, as well as aeration. We have seen our hydrogen sulfide numbers dropping. And again, it was confirmed today by Air Quality Management District measurements that we received overnight.
And we have time for one final question, and that question comes from the line of Phoenix. So, Phoenix, your line is unmuted. Please go ahead.
Is there a timeline for the possible dredging of the channel, and would it involve removing the decomposing vegetation that's causing the smell?
It would involve what will happen here, what's going to happen. So for right now, what the current condition within the channel is important to understand. We basically have no green vegetation showing any longer. It's basically turned to this black soot. It almost looks volcanic when you look at it, the ash around it. And that's the hydrogen sulfide basically taking over and laying down over all of the vegetation. So the vegetation has been completely like broken down and is in like fine, like a granular kind of almost inky way now. So it's essentially, dissolving into the water, and then the water is just becoming this black, filled with organic material and that bacteria that I've been talking about. So what the process for dredging would involve is actually draining the channel, covering it, what we call creating cover dams, draining about 5 acre-feet of water, which is equivalent to 5 rose bowls, 1 foot deep of water, if you will. A significant amount of water that's in there. Plus we have the tidal coming in. So there's some logistics in dredging that put it on that I don't give you. I can't give you a straight up timeline. What I can tell you is when I look at restoration, total restoration, we're looking at a 2-year recovery period, 2 to 3 year recovery period for total restoration of this. The dredging would be one of the first things we would do, and that dredging would actually be removing the muck or the mud, which is full of dead organic material at this point, organics and dead bugs, and hopefully not fish, but I imagine there's some fish matter there too. And there's latent pollutants that are in that mud that would probably require the mud to be classified as a Class A pollutant, and we'd have to take it to a Class A landfill. Pollutants of concern includes things, legacy pollutants such as sulfur, metals, all the metals you imagine, and these are all been laden in there over 100 years of sediment placement in the area. So it's a very, very sensitive operation, is what I'm trying to get across when you decide to dredge one of these areas. It's not just the pollutants of concern from this year or from immediate, but it's the pollutants of concern over many, many years that have been embedded in the sediment in this area that we have to be careful about how we disturb, because we don't want to cause another environmental hazard with the work that we do in dredging. So again, dredging, while it seems like it would just blow it out, we'll get it done. The problem is you could cause a secondary or third level environmental and human health hazard by reacting in that way. So we're reacting in a very thoughtful way, considering, number one, the public's health. And we, again, believe the process by which we're doing that, this iterative approach of applying Epaleon and then, and right now at the same time doing introducing oxygen, aerating it, will ultimately sort of contain the site, keep the sediments in place, contain those pollutants of concern in this location, and then come back with a dredging and restoration, and really a restoration project that would improve and bring back the health of this waterway.
Thank you, and that is all the time we have for questions today. For any additional questions or resources, please visit or contact the appropriate resource listed on your screen. Thank you all for tuning in.